Hi, I'm Cathi, substance use therapist here at Chase Brexton.
And good morning, I'm Ryan. I'm a behavioral health therapist here at Chase Brexton. And we're just here to talk a little bit about how we can make the most of and stay in good spirits when so many of us are at home right now and practicing social distancing or self-quarantining with COVID-19 spreading and all the recommendations that we're facing. So we're all having to adjust our schedules in a big way, and it can present unique challenges to relationships, to mental health, to those of us who are trying to be in recovery from drug and alcohol use, all of those things.
Yeah, so we'll speak to those things as briefly as possible, just hopefully in hopes of minimizing any natural fears and anxieties that come with that, even when we think that we have it under control.
Mm-hmm.
Like, no, I'm fine, I'm not overreacting, but you have like tons and tons of things that you've hoarded and things like that. So we want to kind of take away some of that fear and just crisis response that a lot of people are having and experiencing.
Yeah. So one thing that we thought to discuss is, given that so many things have shifted, it can be helpful to kind of create a new routine and a new self-care routine. So that can include like a new schedule of what times you're trying to be productive at work and what times you're trying to engage in those leisure or self-care activities. Since a lot of the things we often do are not accessible, there are a lot of online resources that are still available, such as like online digital platforms like through the Enoch Pratt Library, where you can do learning through ebooks or digital media. Some different organizations are also offering online fitness videos, and I think the outdoors and getting outside and exercising is also a good option.
And then also some exploring some of those things that you have always wanted to do but just haven't had the time or the opportunity to do. Those are great things. I also saw that some museums were offering virtual tours, and when you kind of get bored and just kind of want to stay in your own space within the home, because if everyone's home, and that can create some cabin fever, some irritability and things like that, and just a good way to look into doing some of those things. Even I heard someone say, oh, I can catch up on my Audible and those sorts of things. Some online studying, things like that, I think will be really good. And also, I wanted to touch on the difference, because we do want to address those that are struggling with recovery issues and trying to, as well as mental health issues.
Mm-hmm.
Isolating is a huge thing for a lot of our patients in our community, and we try to discourage isolating, but now we're asking folks to, hey, distance. So there's sort of a difference between isolating and distancing, and I think for a lot of people, isolation is more of a mental thing where you're just shutting down and you're kind of getting all into yourself in an unhealthy way. And I think that distancing is just kind of still being aware of the community, of things that's going on around you, without what am I trying to say? Like blocking out, everything that's going on. You want to.
So having more time to yourself at home could be a rejuvenative thing and an opportunity for you to grow in different ways.
Yeah.
I think these circumstances right now are pretty different than when we faced national tragedies or weather occurrences in the past, where whether it was 9/11 or terrible hurricanes, people really come together, whether it be a church community or just getting together with large groups of family. And now we're really trying to take precautions to not do that and to have some space.
Yeah.
So
another thing I think would be good, a lot of times we look in the home and like, oh, I don't have time to do this or do that, so you can kind of use that time to be productive, declutter or rearrange and do some household activities to kind of stay busy, stay aware, but not, so you don't spend as much time worrying about what's going on, and feeding those fears and anxieties. You can work on some things within the home, and so those would be great too.
yeah, I think we're also all still here for one another, so reaching out to your family, friends, and loved ones through technology and getting other people's ideas and checking in with one another is going to be crucially important.
And also those social groups, I think it's important to stay connected. If you are used to attending social groups, I think it's important to stay connected through telephone, check in with each other, just kind of be a support to one another during those times.
So for folks in recovery, are there online groups that they could access?
There are online groups,
AA
virtual
meetings?
groups, AA meetings, NA meetings, all types of support groups are definitely always available, even, always available, not even just during this time. So I would definitely encourage to make use of those things, those resources.
So hopefully we'll be able to share some of that material through Chase Brexton's online and marketing pages.
Yes, that would be helpful. Yes. So
right.
thank you.
Yeah, well, thank you for watching. Chase Brexton is still here for all of us, and we are going to try and support one another in our community the best that we can.
Yeah, that was helpful.